Nigeria is marking the Blood Cancer Month to create awareness on the blood disease. Blood cancers occur when abnormal blood cells start growing out of control, interrupting the function of normal blood cells, which fight off infection and produce new blood cells. Most blood cancers, also called hematologic cancers, start in the bone marrow, which is where blood is produced. The three main types of blood cancers are leukemia, lymphoma, and myeloma.
And for more on the Blood Cancer Awareness Month, our Professor of Haematology, Dr. Sulaimon Akanmu, joins us now on the news for more analysis. Help us understand what are the risk factors, precisely what causes blood cancer. Well, we'll get back to...
Hello.
Professor, if you can hear me, I'm asking that you help us understand what are the causes of blood cancer and what exactly should people be on the lookout for?
I wish we know what causes blood cancer. If we know what the causes are, the treatment will be very simple. Just remove the cause and then we are back to normality. Very unfortunately, we really do not know what is the major cause of blood cancer, although we have 1,001 possible theories, what we call etiological factors. We know that some cancers, you may be born with it because you have what we refer to an unstable chromosomal syndromes. When you are born with a situation where your genetic materials are very unstable, then you can easily develop any form of cancers, including what we refer to as blood cancers. We equally also know that we say our environment can be a major problem that can predispose us to developing cancers, particularly when we are exposed to a number of radiant energies, radiation molecules that are capable of entering into our cell and damaging genetic material that can actually predispose us to cancers. We also know that there are biological vehicles that can easily predispose us to cancer. In particular, a number of viruses are known to be carcinogenic. In particular, what they call human papilloma virus, we now know that is 100% associated with development of cancer in women. We know Epstein-Barr virus is so much associated with a particular type of blood cancer, the one we call leukemia that usually happen, Hodgkin's lymphoma that usually happen in children. We equally also know that there are predispositions to cancers that are related to chemicals that we are exposed to. In particular, what you call benzene-based chemicals. Benzene has a way of actually getting into the nucleus of the cell, interacting with genetic material and damaging the genetic material that we have. So there are chemical predispositions, there are biological predispositions, there are also what we call radiant energy predisposition, and there's indeed what we call de novo genetic predisposition. These are what we call as predisposing factors. But the truth of the matter is that when we say we do not know the cause of the cancer, we probably know too much that we do not know which is one of the factors that is responsible for the cause of the cancer in an index patient.
Dr. Sulaimon Akanmu is a professor of hematology. Thank you for sharing your thoughts with us tonight on the news.